A quarter of Nevadans under the age of 65 went without insurance in 2009. Now, a non-profit hopes to fill a critical gap by providing surgery for the uninsured. Do you qualify? Plus, is Obamacare the answer to getting health coverage for all Americans? We'll hear what two doctors think. It's all next on Face to Face.
This is Face to Face with Jon Rolston.
Welcome to Face to Face. We'll bring you newsmakers and commentary you won't find anywhere else. Nevada had the third highest number of uninsured residents per capita in 2009, with 25% of those under retirement age lacking coverage. A Las Vegas doctor is dedicating his practice to treating the uninsured through low-cost surgeries. Now, Dr. Kevin Petersen is taking his quest one step further. He joins us along with Dr. Michael Verni. Gentlemen, welcome to the program.
Thank you.
So, simple question, why?
Because I see patients every day who need surgery, who can't afford to pay for it, no matter how much I discount the price for it. And these are patients without insurance that are not covered by our social safety nets, that is Medicaid and Medicare, and are unable to buy insurance because of a variety of reasons, and are literally have no place to go.
And this has been going on for some time, right?
For quite a long time.
Yeah, for way too long, I'd say.
Correct.
Let me show you what you told the Review Journal about the people you treat, Dr. Petersen. These are people who often go to emergency rooms for years with pain because of things like gallstones and hernias, but because what they have is not deemed an emergency, something a hospital must take care of under the law, they're just stabilized, given some pain pills and a referral to a surgeon. Of course, they never end up having the surgery because they can't afford it. I want to ask you, Dr. Verni, I mean, that probably goes on way too much in this community and many others, just poor folks who can't afford it so they don't get needed treatment, surgeries done, right?
Absolutely.
And so how do you educate those people, besides coming on Face to Face, that these kinds of services are out there?
Well, through programs like this, hopefully that we can reach more people that require surgery that cannot afford it.
What kinds of things do you think people have that they think that they can live with but really need treatment?
In my specialty, I see testicular tumors, a condition called hydrocele, where the fluid collects around the testicle and creates a large mass that makes it uncomfortable for the patient to walk. Kidney stones.
Kidney stones are very painful, though, right?
Most times they are very painful. There are conditions where it's subacute presentation where the kidney may get destroyed with a stone that's subclinical, and these patients can end up on dialysis in the ICU with severe infections. So those are the patients that we're trying to reach.
Well, let me ask you, Dr. Petersen, this has been a problem in this community for a long time. You mentioned the social safety net. One thing that's been frustrating for me to cover the social safety net here for 25 years is it's an oxymoron. I mean, we provide such low thresholds of even Medicaid reimbursement and coverage that's the real problem, isn't it?
Well, Medicaid could be designed better and cover more patients, and I think the Affordable Care Act, what's known as Obamacare, is trying to do that. One of the big problems with Medicaid is that it requires patients actually to become financially destitute.
Right.
Before they receive any benefits. So if you're just above the poverty line, and say, for example, you have any kind of assets, the program requires actually that you spend everything you have, become financially destitute, and then you qualify for the program.
Yeah, the real issue here, of course, is what's the so-called working poor, people who get just above that and don't have any insurance at all and don't qualify, right? That's the real problem.
Absolutely.
And that population in Nevada, especially now, right, with the terrible economy over the last 2 or 3 years, that population's growing, right?
It's tremendously. We see those every day in our emergency rooms, in our offices, and it's frequently hard for those patients to get into our offices because they can't pay.
No-cost surgeries. That's what you gentlemen are offering, correct?
It's charity surgery, and there really is no such thing as no-cost surgery because there's expenses that are associated with it. I was going to ask,
that was my next question. Talk about how you do it.
There's expenses that are associated with surgery that have to be paid. One of the really big difficulties that any surgeon has that wants to do charity surgery is that we can't do it by ourselves. We have to do it in a facility. We need an anesthesiologist. We also need to do various testing and things like this, and these are things that have real costs. So, for example, if I want to repair somebody's hernia and I want to do it without charging them for it, I still have the costs that are associated with that have to be paid. And this is really the intent of the foundation that we've created, is to help surgeons that want to do charity surgery but really need to cover the cost of the facility and other associated costs so that we can do this.
Where's the money coming from? Who's contributing?
Well, what we hope to do is to reach out to the community at large, businesses and hotels and casinos and individuals to get donations.
We're showing the website right now, Doctor. I'm sorry to interrupt you, just so people know. It's called helpinghandsurgicalcare.com. I hope people will go take a look. Maybe we'll get you some money from this program. Dr. Verni, let me ask you, why did you decide to participate in this?
I'm like any other doctor in town. We're all trying to help. That's why we went into medicine. As Dr. Petersen outlined, there's very difficult to find facility avenues to do this. Our skill is just a small part of it. The rest of it requires additional support, and hopefully through this avenue we can attract more sponsors. Not only hotels and businesses, but maybe even medical equipment manufacturers who will donate the equipment that we can help these people.
How do you get past the profit motive for some of these folks? I mean, some of these businesses are hurting now too in the economy, whether it's, big businesses, casinos, medical equipment manufacturers, they're hurting too, right? What's their incentive to do this?
That'll have to be individual decisions, obviously,
right.
And a conscious decision. Hopefully we can all come together to help these people, and that should be a motivation.
Do you think that most doctors are more beneficent than people think, that this is just a bad rap? Because you know that's what's been, you guys know the image problem that you have. That's going around too, right?
Well, you understand that 1% of the doctors or less give the rest of us a bad name. Most doctors went into medicine to help people, really to help people. We're not businessmen. We have not learned to be businessmen in medical school. And unfortunately, with our today's economy and insurances, the government involvement in healthcare, we have to become that, businessmen, bankers, and so forth.
I want to talk about the government's involvement in healthcare. You mentioned the Affordable Care Act, which its critics call Obamacare. I want to talk about that, the impact on your practices, and again, we'll keep telling people where to go. It's helpinghandsurgicalcare.com. It's a new program. Take a look at it. We're back with a couple of doctors who are donating their time to help you get needed surgeries for free. Welcome back across Nevada to face-to-face free surgery for needed problems. A couple of doctors are here today to talk about that and to talk about the impact of what people like to call Obamacare on their practices and how it's changing medicine. I know you set up this foundation. We talked about that, and this is an ongoing thing, but you're also going to have a one-day program, I believe in November, on November 15th, where people can get free
Correct.
surgery. How do you qualify for that? How do people get this?
Well, the way the foundation is set up, it's set up to serve Nevadans, so we require that they be residents of Nevada. They need to have a condition that requires surgery that will improve their lives or remove the risk of death. That is a necessary surgery. They need to be medically healthy enough that they can undergo surgery. And for right now, the type of surgery they need needs to be something that we can offer. For example, we're starting out doing outpatient type surgery because we can control the cost of those type of procedures much better than we can for surgery that requires hospitalization.
You're not talking about heart transplants. You're talking about doing something
for one heart transplant, we can probably do 100 outpatient surgeries for other patients. So we're trying to help as many as possible. The other requirement, which is important, is a financial need. Now, we don't really strictly require that patients be financially destitute or at the poverty line. And in fact, those patients probably qualify for Medicaid, and we're...
You want people without insurance, correct?
We want patients without insurance.
They have to prove that somehow.
And they signed an attestation. You know, we're not the IRS, so we don't do a tremendous amount of investigation. But, you know, patients have an inability to pay for surgery, for example, not necessarily because they're absolutely poor, but because they're on fixed incomes and or they have other responsibilities and so on. So we take all these things into consideration. There is a financial application that's part of the application.
So you're doing the evaluation, you'll do the evaluation process in advance of November 15th. How many surgeries, how many doctors are going to be there that day?
Well, I've got now about 5 that have volunteered to participate, and we've received online over 100 applications, plus we've had about as many telephone calls. So we're currently in the process of taking the applications, reviewing the applications. The applications will, at some point, will go before our physician panel, which will assess the surgery for medical necessity and how serious the need is so that we can pick patients.
Yeah, unfortunately, people are going to get turned down because you can only do so many, and that's just a fact of life. I want to ask you about something that you said in the newspaper, Dr. Verni, because I thought this was interesting. This is what you told the RJ earlier this month. A majority of doctors used to do a lot of pro bono work until reimbursements for our work became such a difficulty. We're struggling to make our overhead. Now, a lot of people are going to say, we talked about this in the previous segment, oh, he's exaggerating, struggling to make the overhead. When you're talking about reimbursements, you're talking about from the federal government, I'm gathering, for Medicare and such things. Talk about what you mean if I'm wrong.
Well, it's not just federal government, it's insurance companies. What the federal government does, the private insurance companies follow frequently. And for whatever reason, it's became much more difficult for doctors to continue to practice in the private sector. And as I said earlier, they become businessmen and bankers, and it's hard for them to practice medicine. And they have to turn patients down. And not only that, they have to become social workers because, as Dr. Petersen alluded to, in order to provide free surgery, you have to have a facility to do this, and you have to have anesthesia and other services. And sometimes you can't take time to arrange that. It takes more time from your other patients. So this program will help us, for those who want to participate and volunteer, to accomplish those goals without really affecting their practices.
You're essentially saying, and correct me if I'm wrong, that insurance companies over the last few years have really put the squeeze on you guys, and essentially by reducing the amount that you get reimbursed for certain kinds of procedures. Is that right?
I don't think that's a big news. That's been going on for years.
And yet still you're able to do this. But you're going to need a lot of private sector help. HelpingHandsSurgicalCare.com. People should go there if they want to contribute or want to find out more about the program. But it's got to be an even bigger problem getting people to contribute during this bad economy, right, Dr. Petersen?
Well, we're fortunate to live in a community where there is a lot of philanthropy activity. There are big businesses and individuals that historically have given for many years and continue to give to causes that they feel are in need and are important. And I think that this is an important need. And you know, the surgery that we can do for these patients, you know, is life-saving or, you know, life-restoring, putting patients back to work, removing threats to life. You know, it's a big deal.
Yeah, it is. I can't think of a better charitable endeavor for anybody. HelpingHandsSurgicalCare.com. We're going to talk a lot more about it. We'll talk about the uninsured in Nevada. We'll talk about what people like to call Obamacare when Face to Face returns.
With Jon Rolston.
Welcome back across Nevada to Face. We're talking about health care in Nevada and the United States with a couple of doctors. We're part of a group that is providing free surgical care. On November 15th, you can find out if you're eligible. Go to HelpingHandsSurgicalCare.com and learn all about the program, or go there if you want to contribute. Gentlemen, I want to talk to you about the problem that the Affordable Care Act was supposed to address, which is the problem of the uninsured and covering everybody. I want to show some people some statistics about Nevada. Third highest number of uninsured residents per capita in the nation. A quarter of those, as I mentioned earlier, under 65, not covered at some point a couple years ago. Nevada's low rate of insured, which is not a surprise to state experts, is primarily the result of a lean state health care system compared with the rest of the country. Namely, unfortunately, as I mentioned earlier, Nevada's restricted Medicare, I think they mean Medicaid access to the poor, while other states offer public health care coverage to more residents. A separate analysis done for the state by a contractor, public consulting group, painted a picture of the uninsured. Here are the findings released this August. 445,000 Nevada adults between 18 and 64 did not have health insurance. Almost 18% of children are uninsured, or 121,386. This is more than twice the national average. You're trying to help with that. We talked about the uninsured, that you're trying to help with these surgeries. Will the Affordable Care Act help with that problem?
Well, there's one segment of the population that's already been helped. Clearly, and recent statistics have shown that, and that is that the children under the age of 26 years of age can now be covered on their parents' policy. So that segment of the population.
That's one of the provisions of the bill that kicked in early.
Yeah, that's one of the nice provisions of the bill that really is having a positive effect. Unfortunately, a lot of the other there are a lot of side effects, unintended consequences of the bill that have been making it worse for some patients. For example, the cost of insurance is not going down. It's actually going up, and it's gone up 20 to 30% over the past couple of years.
Why?
Because the insurance companies are anticipating increased costs. And so they have to generate more revenue to do that. The other thing that's happening is that more companies are giving up insuring their patients because it's becoming more costly for them. So more patients are being dropped from the insurance rolls as a consequence, an unintended consequence of the legislation.
Legislation, those provisions haven't taken effect. This is the problem, of course, Doctor, is what your colleague here is pointing to. Is a lot of these insurance companies are saying, listen, the Affordable Care Act is going to kick in 2014. We have to prepare to be able to afford it. Is that a legitimate concern on their point, or are they using this as an excuse to raise rates?
I think it's probably both. I don't think there's many insurance companies that are going out of business insuring patients.
Exactly, but that's always been true, and doctors have always talked about the problems, as you have here, with insurance companies. But is the intent, I mean, the intent of the Affordable Care Act, a lot of people think, is a noble one, to get everybody covered. Is there a way to do that without, I mean, you can't save costs in one place and not increase costs in another, right?
Absolutely. The intent is noble, but I think execution will be difficult, and I think it'll probably leave patients uncovered and decrease access to care.
Is there any way to do it, gentlemen, that would make any kind of sense?
Well, you know, if you think about how it was 25 years ago or 30 years ago when I was in training and started practice, back then everybody had what was called major medical insurance. And it was insurance that was just designed to cover hospitalization or major surgery. And it wasn't very expensive back then. Now we have policies that are pay for the first dollar of medical expense and are comprehensive and cover everything, and they're unbelievably expensive. And if you really wanted just a major medical policy, because, you know, it makes good sense, you can save a tremendous amount buying it, the insurance companies don't want to sell it because that's not where they make the profit.
Right.
And then we have the ACA legislation, which now is backing up insurance companies and saying this is the only policy that we're going to approve. You can't buy the other ones anymore.
ACA, Affordable Care Act, in case people don't get the acronym right away. They're used to hearing it called Obamacare by the critics. When we come back, we'll talk about something that frustrates patients a lot. Hidden medical fees. Are they hidden? We'll talk to these doctors about that when Face to Face returns. Welcome back across Nevada to Face to Face. We're talking about health care in Nevada and the United States, the Affordable Care Act, and more with a couple of doctors of an innovative program. They're providing free surgeries, especially on November 15th. Go on their website. We're going to mention to you. Get ready for it in a little while, and you can check it out. And if you want to contribute to what is one of the great causes in this state, you can go there too. Dr. Petersen, you provided us with some information regarding fees for medical care. And I want to talk a little bit about that. Here's what you provided us. There are no standards for medical fees, and there's little public information about fees. Every provider has multiple fee schedules depending on who the payer is. Providers may charge whatever they want to uninsured patients because they are not protected by contract or law. Medicare and many insurance companies pay hospitals less than the cost of providing care. As a result, excuse me, hospitals overcharge other patients to make up the difference. Overcharging for medical care whenever possible is widespread. I remember this way back in the day when I covered hospitals. Cost shifting, that still happens in a lot of hospitals. Some of those things I think may surprise some people. Is there anything you can do about that?
The cost shifting? No, that's a fact of life. The fact is that the largest insurer in the country, which is Medicare, pays hospitals basically 95% of their cost of actually taking care of a patient. So obviously hospitals can't close, and so the 5% difference has to come from someplace else. Now traditionally what has happened is that the private insurance companies have made up that difference, and hospitals have received much better reimbursement from private insurance than they have
But not
Medicare.
anymore.
And that, unfortunately, that's changing. The insurance companies are bringing down their reimbursements to equal Medicare, and a lot of pressure is being put on large facilities, hospitals, and other facilities like that.
You've heard the nightmare stories for years. People go into the hospital for something, they get the bill in the mail, and they look, and there's this long list of fees that they never knew about. That's still going on, right, doctor?
I'm sure. I'm not privy to the bills from the hospital, so I'm not sure exactly what's on it.
But some of your patients must say something to you once in a while, no?
Sometimes they do, and we refer them to the hospital business office, obviously, because we cannot take care of that.
So let's talk again. We have about a minute left, gentlemen. I want to tell everyone the website again, helpinghandsurgicalcare.com. Let's have just a general discussion, 30 seconds for each of you. Do you have any optimism about where medical care and costs going in this country?
Well, I think the care is good. The cost is going in the wrong direction. And
any way to stop it?
I think we would need a tort reform, global tort reform. A lot of doctors practice defensive medicine because they're afraid to, what if we don't do this? What if we don't do that? That would be a huge step in correcting the
What do you think? I'll give you a few seconds to talk about that.
I think a large part of the inflating costs of health care is due to insurance companies and pharmaceutical companies being exempt from antitrust laws. They act as cartels and have monopolies, control the market, and control prices of stuff. And if that were all leveled and real competition forces were applied, costs could come down.
All right, gentlemen, I really appreciate your willingness to come on and talk about all these issues. Helpinghandsurgicalcare.com. It's a great program. Thanks for coming on the program.
Thank you for having us.
Now, on the next Face to Face is the man in charge of public safety abusing his power. Find out why a Reno highway patrolman's crying foul after state troopers stormed his home. Next, Face to Face.